Managing our minds is essential to how we show up. I know that as a doctor and professional coach, wife and mum to 3 sons, gosh, it sounds overwhelming when you say it out loud, but it doesn't have to be. If you are feeling exhausted, overwhelmed, and a little stuck on how to get back on track, Thrive is perfect for you. It's my self-paced program with practical strategies and mindset tools you can use anywhere, 24/7, and it's on sale for $49 at drjoebraid.com. If you prefer a one-on-one tailored catch-up with solutions designed specific to what's going on in your life right now, Power 60 is where we can connect and get straight into it. I can't wait to meet you. Or commit to 3 months of coaching with me, with program vitality to unlock ongoing personal support, training, resources including worksheets and audio content, and professional development for true transformation. Shout out to Sarah, who has already taken part and kindly said, "I cannot overstate the impact of Dr. Joe's coaching. I now set boundaries with kindness, push through procrastination, and have realistic goals and so much more." So if you also want to turn overwhelm into transformation, find out more at drjoebraid.com. There's a link in the show notes. Let's get into today's episode.
Welcome to the Burnout Recovery Podcast, a guiding resource dedicated to healthcare professionals on their journey to overcoming burnout. Spearheaded by Dr. Joe Braid, a certified professional coach and rehabilitation physician. This podcast offers practical strategies through expert interviews and personal resilience stories, providing invaluable tools for navigating professional challenges while prioritizing well-being. Regardless of your role in healthcare, this podcast acknowledges the toll of your work on your overall health and is committed to supporting your recovery from burnout and fostering a fulfilling, sustainable career. So, if you're ready to begin a transformative journey, join us for each new episode. Together, we'll navigate challenges, celebrate successes, and build a supportive community of healthcare professionals.
Hello and welcome back to episode 99 of the Burnout Recovery Podcast. Today, I am absolutely delighted to welcome Dr. Tabitha Healey to the Burnout Recovery Podcast, all the way from Adelaide. Welcome, Tabitha.
Thank you so much, Joe, for having me on.
I know Tabitha through the Doctors Who Coach Doctors Network, which Tabitha was actually really instrumental in starting up over a year ago now. And Tabitha has a multitude of roles. I'll give you a short bio and look forward to hearing more of your own version of your journey to where you are today. So Tabitha is an executive health coach, a business owner, a board member, a speaker, a clinical hypnotist, and a retired medical oncologist. Professional coaching changed the course of her life, and Tabitha now enjoys assisting others to practice medicine safely and sustainably. Great to hear, Tabitha. We connected over the recent Curious About Coaching Summit as well, and you kicked off the day with a great topic around why every doctor deserves a coach, the evidence for your investment. This is going to be a really juicy topic to talk about in the podcast, but before we get to that, I'd love to hear about your journey up to where you are today and maybe how coaching has been a significant part of that journey for you.
As you mentioned, I trained as a medical oncologist. I did that for about 25 years. I specialized in the care of young women with breast and gynecological malignancies. Along the way, I built up a very large private practice, which I was one of the leading partners. I had a couple of kids, got married somewhere in there, and I was going along reasonably well. I'd invested a lot. Excuse me, there's an ambulance going past us there. It seems to be on these things. And so the aspect of I invested a lot in my own well-being in order to practice sustainably. Then in about 2017, I just hit this complete emotional wall where I'd ceased to be able to care. I had ceased being kind. And there were a couple of things that just happened both in my personal and professional life where I really had to stand back and take stock of who would I become? And it was not the person I planned to be. So it was at that stage I actually saw a career coach psychologist, which was my first experience with coaching, didn't even know it was a thing. And after some sessions with them, I really worked out that it was time for me to step out of medicine for a period of time. So I planned to retire, but I worked out I wasn't very good at retirement. I got bored. I drove my children crazy. So I went back and worked in palliative care. And then it was while I was working in palliative care, I trained to be a hypnotist in order to help with pain and suffering more effectively. And then I also studied to be a coach. Found my way through that, had to do a few courses before I found the one that was right for me. And then I really launched that practice, and it was during COVID, and just the healthcare system was in complete overwhelm. Doctors were burning out left, right and centre, very, very distressed. And so business really took off, and it just grew organically from there by word of mouth. So I now coach predominantly doctors, senior medical leads, allied health and nursing staff, really in the scope of wellbeing, burnout, how to navigate life, how to navigate work, and a lot of leadership stuff as well. So it's a great combination. I do quite a bit of public speaking as well for organisations about burnout, wellbeing, psychological safety. So it's a really fun life. And I guess as we then talked about through the coaching summit was I've become a great advocate for the fact that every doctor really needs a coach. I think if I had had a coach throughout my medical career, I probably could have continued to work sustainably. But without having a safe sounding board, somewhere to land, somewhere to workshop things, and just to be able to often talk about what was going on in my head, I think that's why I struggled.
Yeah. Yeah, fascinating. Thanks for sharing that. Let's go back to that point in 2017 where things were not the way you'd anticipated they were going to be. And you tried retirement, or you put a pause on your career for a while. Can you share with the audience what it was that led you to look for a career coach at that point?
So, yeah, it was my complete lack of compassion. So I walked into the room of a young girl who was dying with metastatic breast cancer, and she was crying, and I said to her, "I'll come back when you're finished." And I walked out of that room. And so I was really reflecting on what I needed to do. And I knew I wasn't psychologically unwell. I wasn't depressed. I wasn't anxious. So I didn't need a psychologist or a psychiatrist, but I needed somebody who could help me just pull apart all of my thinking, which was so scrambled, to try and help me find a clear path forward. And so it was sort of Googling that led to that, talking to people I knew in the eastern states who were in business and management, where, of course, coaching is completely routine. Every senior leader in corporations and in government as well have career coaches and performance coaches. And so it was then just Googling, and I found someone in Adelaide who was the lovely combination of being psychology trained but had moved into career coaching, and he was fantastic. And it was just that space to talk, that space to say what was working, what wasn't, and to create a plan about what I needed to do next.
Yeah, thanks, Tabitha. Thanks for sharing those insights, because sometimes I think when we're head down in our medical careers, we might not be aware of the scrambled thinking or the value of time to think. Doing productive work is so often how we've been drilled and trained and what we're valued for. And I think coaching does have that really valuable, tangible and intangible outcomes, but it's a different hour, or it's a different time in your week than the very productive outcome-based tasks we're otherwise doing in our clinical careers, and which we're so used to. So really great to hear about that, seeking somebody to help you with your thoughts or with your thinking time.
And it's so interesting because so many of my clients, when they first see me, say, "Oh, it feels so indulgent to talk about myself." And they're often apologizing. And the big thing I find is often breaking the habit where they keep asking me how I am. And I keep having to say, "It's not about me. Thank you very much. This is actually your time." And it takes people, I think, often a couple of sessions to just relax into the fact that they can come and they can simply put it all out there. And we talk about it, in fact, it's like putting it out on the table, and we can examine it from different directions. And then you can choose to take back the bits that you want to. You can leave behind the bits that you don't want to carry anymore. And then you might remodel some aspects of that. And so it is just such an incredibly effective tool. And I think as well, it's so appealing because it's performance enhancing. But rather than saying that there's anything wrong or you're broken or you're not good enough. This is about saying, I identify that I've got capacity and capability to be even better, be that personally, professionally, in my relationships. And it is so wonderful to see people grow and just to also reconnect with what they love about medicine and the parts of it that they are just so good at. But as you said so beautifully, they get lost in the grind, and they get so overwhelmed.
Yeah, great. Yeah, thanks for highlighting all of that. Let's go into a short version of what you shared at the Curious About Coaching Summit around why every doctor deserves a coach and the evidence around the investment. So it's time, so it's money, it's possibly time away from either your family, possibly your workplace. I find people often have busy schedules and coaching sometimes comes after hours. But what would you like to share around this juicy, valuable topic, please?
Absolutely. So it was that interesting thing of moving from oncology trials, which were often pharmaceutical companies spending enormous amounts of money on thousands and thousands of patients with new drugs, and shifting into coaching was tricky because the data is smaller. It is often qualitative. It's very difficult to standardize. But there are a number of randomized control trials that look at doctors who are coached versus doctors who are not. And they incorporate sort of thousands of doctors, mainly in the US. But what they discovered in these trials, the doctors who received coaching, and they're either over a 3-month or a 6-month period, usually either 2 or 4 weeks apart, was that those doctors who received coaching had markedly improved benefits in terms of resilience, well-being, quality of life, work-life balance, engagement professionally. And they also saw significant reductions in stress and burnout, and to some degree anxiety and depression. So they were very, very clear. They were very consistent. And the other beautiful aspect was that those changes were sustained over time. There's not long-term follow-up, but at 3 months and 6 months post-cessation of the coaching interventions, there were sustained benefits. And what they often saw was that the change between the two groups actually moved in both directions. So the group that were coached incrementally improved, and the group that wasn't coached actually incrementally deteriorated. So if they kept just doing what they were doing, their scores actually reduced. And I'm very happy I can share links to those articles in your show notes so that people, if they want to look into it further, can do so. But certainly clear benefits. And as you say, the return on the investment. So, and I'd say from a cost point of view, probably time is the hardest, but for a lot of people, you'll find that your professional development funding, if you are medical, will cover the cost of coaching. Otherwise, it can often be claimed as a tax deduction, as leadership coaching. If you work for an organisation, it's often worth speaking to those organisations to fund coaching for yourself because it has such a significant return. Because the other area of research is in leadership coaching. And what it shows is that organisations that invest in their staff with coaching have much higher rates of retention, much higher rates of engagement, and also those people improve their leadership skills in terms of organisation, their understanding of the organisation, their engagement, and their communication skills. And so from an organisational point, you can make a good case for them to fund a number of sessions. And that's what my sort of senior nurse leads and senior allied health leads do, that they apply for their organisation to fund their coaching.
Yeah, fantastic. And I think that's a really important consideration as we go through our careers in a job where we've trained to provide service, generally on the ground, client facing and so forth. And then we go through the ranks and we go through the years and we become more interested in different things. And we find ourselves in a leadership role, but not necessarily with the training to be a confident leader or the outcomes that you want to have as a leader in your department as well. And I've also done leadership coaching training, and I think it's really helpful for us to understand more of those management approaches and styles of leading a team than what we might have been trained in when we've had our medical training through the different grades and the years and so forth there.
Absolutely. And I think one of the most important things is leadership's really lonely. So the higher you go, the more isolated you get. And I think particularly leaders in the government sector are at needing to service the needs of the executive and the administrative from a budgetary perspective, and then desperately trying to support their team, what their requests are. So, it's a highly conflicted, highly lonely space. And a lot of hospitals will support leadership training, but what I've found is that most of the coaching that goes on there is not coaching that's delivered by doctors. And so it's people who have a limited understanding of the challenges of healthcare and how unrelenting it is, so much uncertainty and so much at stake. And so I coach a number of people who do get coaching paid for by the government sector by a non-medical coach, but they come to me because of that level of understanding. And there was work out of Harvard this year from looking at, it was the Mayo Clinic, but looking at what are the competencies that you should be looking for when you're seeking a coach as a doctor. And really what they found was that you don't have to be a doctor to coach another doctor, but there are huge benefits because of that understanding of the complexity, that understanding of the personality types that medicine selects for. So a type A perfectionists who are highly self-critical, often carrying a touch of people-pleasing and imposter syndrome. So, they're a really complex mix. And so working with somebody who understands that, working with somebody who understands that they're can sometimes not be an off switch in terms of your availability and your accessibility, of understanding how much you give to others and how much damage that can do over time if you're not supported. So I really am a strong advocate for the fact that doctors will do better when coached by other doctors because of that level of experience.
Yeah, fantastic. Thanks for sharing all of those points. And as a reminder, with our CPD, with our continuing professional development, coaching and mentoring can also be one of our two categories that we can submit on our annual CPD. Great. What do you think lies ahead? I'm curious, either collectively, individually, or the future of coaching in healthcare. Like a wide question for you there, please, Tabitha.
So from a personal perspective, the thing I love about the career that I've carved out is that it is one that is highly, highly sustainable. So having trialled retirement for 6 months and discovering I'm not suited to it, I'm very excited that this is the career path that I'll be able to do, as long as they fit well into my 70s or so. And I also think it's one of those beautiful careers where age creates wisdom and authority. And so people aren't going to write me off because I'm older. So I see that it's highly sustainable. It's also flexible for me. So that ability to work around my now adult children and being able to catch up with them and to maintain my own health, well-being and experiences as part of that. From the broader aspect of this, I think for the medical space, I would love to see that it is taught in medical schools that, yes, you need a GP, but also find yourself a coach. And so that as medical graduates come out and they embark on their career, they form a relationship with somebody who can support them at the stages throughout their career, through their exams, through their consultancy, making life decisions, relationship sort of complexities, all of those things. So I would love to see the industry expand and be very, very successful. And then one of the other things I do is sit on the board of Health Coaches Australia and New Zealand. And really what I would love to see is that health coaching in particular becomes part of the primary care framework. I still think our model of healthcare is so disease focused. And if we continue along that path, we cannot sustain care for our population, and lifestyle related disease and illness, morbidity and mortality is just climbing exponentially. So I would just love to see that we create a healthcare system and a Medicare funded system where a health coach is embedded into medical practices. And so you see the doctor for your diagnosis and your treatment plan, but then to actually modify your behaviour, you work alongside a health coach so that those changes are embedded, because coaching is about assisting people to create and embed behavioural change. It's not about telling people what to do. Interestingly, that model is embedded in New Zealand. So health coaches are part of primary healthcare. And the US, there is a big push, and it's looking like it will get over the line in coming months, where once again, health coaching is embedded into primary care. So we need to accept that you cannot tell people what to do. You need to coach and assist them to find their own path that's consistent with their experiences, their personality, and then so that they can enact successful behavioural change.
Yeah, fantastic. Yeah. I love that point around, every doctor needs a GP. I think that's a message that's got out much more recently, and tagging onto there, every medical student or every trainee doctor would benefit from not only having a GP, but also having their own coach as well, and how we can support the universities coming on board with that, or the medical student societies, or where our area is that we can engage with them successfully and invite them to see the return on investment, or the value, or the tangible and intangible benefits of coaching for the short, middle and long term for these individuals who, let's face it, the health system remains under pressure. We've got through the pandemic and there's still a lot of pressure going on, and maybe coaching would be a part to significantly support those who are in health, continue to practice sustainably and safely, as you've shared already.
And I think from a financial perspective, if you look at the fact that, the cost of replacing a doctor lost to burnout is about $500,000 by the time you recruit, retrain, and then recoup your losses from the productivity. And so if you think of the cost differential and the return on your investment, that coaching is relatively cheap, can be done at reasonably protracted intervals for people in terms of touching base. And so that investment of, if you funded the fact that doctors received regular coaching support, and then you significantly reduce their risk of burnout, it's a pretty clear return on investment.
Sure is. Yeah. Fantastic. Yeah, that's really good. Okay. So many exciting things for the future there. Clearly, we could talk about this for quite a while, but I like to keep my guest interviews fairly punchy and to the point, and there's so much you've shared already. Would you like to share a self-care strategy that you rarely miss, please, Tabitha?
I'm highly ritualized because it's what works for me. So it's about morning routine for me. So I walk 5 days a week up a beautiful hill in the foothills of Adelaide with my dog, watch the sunrise, meditate on a rock, come back down, and then 2 days a week I do yoga practice early in the morning. And then my latest thing is I've just learnt transcendental meditation, because I've always struggled to find a meditation practice that sits with me. So I'm currently embarking on that, and finding that it's working well for me. But I think from a client perspective, the thing that I start with for everybody is sleep, because if people are sleep deprived and overwhelmed, it is really hard to reset. You can't get up in the morning and do these things if your sleep's been very disrupted. So I always start with sleep as my number one recommendation, and helping people to achieve that. And then number two is starting to move your body, because once again, if you are not moving, then you are holding on to your distress and stress. And so getting people to gently start moving, but if they're burnt out, being really careful about doing that gently and slowly to begin with. So many people go out really hard, and then that just evokes greater cortisol release. So sleep number one, exercise two, and then I talk quite a bit with people about pausing and what they can do to quieten and still their mind throughout the day. So many people have so little control over their day in medicine in terms of back-to-back consultations and demands from so many different directions, but just training people that in these micro moments to be able to pause, to still, to connect with their breath is where they have control, whatever else is going on around them. So really bringing people back to, where do I have control when it feels like so much is out of my control?
Yeah, really wonderful. Yeah. What a lot of gems. Thank you so much for all of those. I totally second sleep being a significant priority, and movement. And then when the client, I guess, is already engaging with you, then the mindset part starts coming in too. And the support part is another pillar that I often work on with people there too. Yeah, great. Why don't you share with me, please, how people can best connect with you? So the only place I am is my website on the internet. So I'm in awe of people like you, Joe, who can run podcasts and blogs and all the rest of it. I'm just
day in, day out, happily seeing clients. So my website, so it's, if you Google my name, Tabitha Healey, I will come up and my website will come up. So if people want to reach out by that, very happy to connect, either on coaching, or if people have organisations where they feel they could benefit from me coming in and speaking to their organisation about burnout, wellbeing and stress management, I'm really happy to spread the word.
Fantastic. Yeah, I'll make sure there's a link to your website in the show notes for people today. Well, Tabitha, thank you so much. We've got through a lot in actually not such a long time, so I'm sure it will be fruitful and full of gems for the audience today. I really appreciate you coming on the podcast as a guest today and look forward to continuing to connect with you through our network in Australia and beyond.
Beautiful. Thank you so much for having me, Jo, and for all you do for doctors and keeping them well. It's magnificent.
Thanks so much, Tabitha. See you soon.
See ya.
Thanks for listening to this episode of the Burnout Recovery Podcast. If there's someone in your world who would also benefit from this, please share it with them. Remember, you are not alone, and there is hope for a brighter, more fulfilling future. Let's continue this journey together, one episode at a time. For more resources, including how to move from dread to delight, head to drjobraid.com.